I'm going to call the meeting to order. This is our 1st of June regular board meeting. I want to welcome everyone, and I'll have roll call. Mr. Moore.
Yes. Ms. Parker? Here. Ms. Kinzer?
Present.
Ms. Hopkins? Mr. Fulbright?
Here.
Mr. Moore is present. Mr. Atkinson?
Here.
Mr. Sims?
Here.
Mr. Beaver?
Here.
Mr. Howell?
Here.
Ms. Morency? Mr. Dudley? We have 9 present. We do have a quorum.
All right, thank you. Now, if you all will stand, I guess I will lead you in the Pledge of Allegiance and a moment of silence. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Next item on the agenda is to adopt an agenda, and I'd like to add a couple of things to the agenda for your consideration. I'd like to move up the, it's under FYI, the CARES Act funding update. If we can move that up to 8.7. And then I'd also like to add a discussion of the hiring freeze for employees, and we would make that 8.8. Is that correct? Policy, it's not. 8.7 would be a CARES Act update, and 8.8 would be discussion of the hiring freeze. Is there any other additions? Then I'll entertain a motion. A motion by Mr. Moore, seconded by Mr. Howell. Is there any discussion? Then we're ready to vote. Please vote. Tommy. I vote aye.
Didn't prompt you.
No,
I'm not trying to mess it.
no, I know.
Okay, I'm gonna let.
Well, I can.
You're all right. Bring it back up. You said that.
All right, let's go on here. We've adopted the agenda. So, any recognition or announcements, Dr. Marzak?
I don't think so. My computer just died.
Well, good. We're in real good shape up here.
Starting out on the
Yeah. Next is the Murray County Education Association.
Okay, how about that? After 9 months, I remember to turn it on. Chair Kinzer, Dr. Marzak, and board members, this has been a rough week. I think we need like a 2020 do-over, like just start it over. There's too much for too many children and adults to try to grasp, I think, right now. My own son was a little worried about grabbing breakfast yesterday, 'cause he can't verbalize, whether he's afraid of getting sick or afraid somebody's gonna be upset, hurt, angry, too much kids are seeing. With COVID-19, the unrest and changes in economic prosperity, not only for communities but families, and here in Murray County on the cusp of major changes in Murray County schools. We'd like to thank you for always allowing us to have a voice in board and district decisions. I'd like to thank Mr. Lindsay for reaching out to set up a meeting to discuss employee concerns regarding returning to school in the light of COVID-19. We'll be having that next week. We're going to develop a survey just to get some idea, but we have the gamut of feelings amongst our teachers, employees, and parents, just like the rest of the country has. You have people who are ready to go back, go back. And there are people who don't think we're going to be ready to go back. I think the most important thing is that everybody's feelings about it are respected and that they're valued. I would like to thank Mr. Pearman and his crew as well as Mr. White from Central for allowing MCA to hold the employee meet and greet for the 3 district candidates for superintendent. They were gracious and helped keep social distancing available. It turned into a great afternoon of discussion as it included some additional community members we weren't expecting. I was a little nervous of whether we were going to have enough chairs, but it turned out fine. And we did get some good feedback from those community members. MCA provided a feedback form. I've compiled those. I also gave Ms. Kinzer the original feedback forms so that you know that what's in there was actually what they wrote down. So I have them stapled by candidates. One thing Murray County Education Association and employees would like to be sure happens is that the candidate selected is of the best selection available. Like everything else, there are people who question whether the TSBA, or people question everything really, whether TSBA provided the top 3 candidates or were they kind of checking off boxes. And we beg Murray County Public School Board to do their due diligence of selecting the most appropriate candidate, as you are putting the future of Murray County school children and employees in their hands. This candidate will have to impress the community, the employees, and the commission. Please remember, as you go forward, the mission of Murray County Schools is to educate all students for life. As I've sat in board meetings over the past several years, I've heard board and community members concerned about finances. Some of that has been addressed through the 81 Act. One thing I always hear about is concerns about our educational standing and student academic progress. And that's really why we're here. We have to have the finances as part of it, but academic progress and the student's education is really our mission. The reason the 3 choices were selected by the Tennessee School Board Association is clear. They met the asks of the community members, teachers, and board members. However, I hope we can choose a candidate that has a bit of all the tasks, that can address a bit of all the tasks, some of the financial, but also some of the academics, educational rigor, and building teacher morale. If it's appropriate at this time, and I've given you a copy of it, I know that there's other things you have to address. I know you're also having a meeting on the 8th of June to address it. So I was going to see if it was appropriate to kind of review the summations, or if you'd like to wait till the work session. And if you wait till the work session where you discuss the act, where you're going to open it up to public comments, then we would ask for a little more than 2 minutes. But I don't mind kind of reviewing some of the what I provided in the packet.
When I said 2 minutes, 3 minutes, whatever, I was thinking there might be several that would want to speak.
Right.
And so that was why.
Okay. I just want to make sure that MCA will be recognized at that meeting, I guess, if we don't do it today.
Doing it today meaning going over all this
just kind of
right
reviewing
now?
It, yeah.
What are the wishes of?
I guess just a summation of the 3 candidates, but I provided that for you, but I would also like to have it recorded, I guess, so people can hear it.
Well, I will give you an opportunity to do that at the meeting.
Okay.
All right, thank you.
Thank you.
All right, any public delegations? Mr. Cobb, will you look and see if anybody signed up to speak right there? Okay. All right, then moving on. Get down here. page here. Under new business, I realize that, the MOU with the Boys and Girls Club was something we oh, excuse me, we have not voted. I do that every time, don't I? Sorry. I'm sorry, we didn't vote because my computer, I wasn't signed in. I'm now signed in, so can we now vote on the, consent, the motion that was made?
I'm making a motion to consent items. We haven't voted yet.
I'm really okay, but when my computer is all messed up and I'm sitting looking at this, I'm like, okay. Is there a motion to accept the consent items? All right, Mr. Moore made the motion to accept the consent items. Is there a second? Ms. Parker, thank you. All those in favor say aye, or no, let's vote, excuse me. Sorry, I'll leave.
Please vote now.
How do I vote? This is all new to me. See, there's no way for me to vote.
You're logged in as yourself?
Mm-hmm. He came up here and told me I'm me. See? The chair votes yes.
Do you want to log out and try to log back in?
I've done it a couple of times. I'm just gonna get through this.
Log in and check out your profile.
All right, now, we're up to new business. The Boys and Girls Club is an MOU we discussed at the work session, but they had some changes, just some dates and times changes on it, so we put it under new business so you all would have an opportunity to see those changes. I think they're highlighted. So if I give you a minute to look at it, was just, they just sent it to us a day or so ago, so felt like we wouldn't want to leave it on consent unless you had an opportunity to see the changes. Motion to approve? Okay. Seconded by Mr. Fulbright. Any discussion? Then we're ready to vote.
Okay, I had a problem about the meter, but I can move it. What do you want to take? It's not very close, I think it is. So we're doing on the MOU, correct?
We're voting on the, yeah. And chair votes yes.
One or more did not vote.
Are you, we're not able to see the. We're all having trouble. If I log out and log back in.
You have some trouble. If you scroll up, Miss Shirley, it's already open. If you scroll.
Mine doesn't show, do you see my screen here?
Yes, yeah, we're looking at it. Go the other way. Scroll up.
Oh, I'm so sorry.
There you go. So go ahead and, you're welcome. Go ahead and mark Ms. Kinzer as yes. Oh, that's the consent. Oh, you never took action on consent agenda.
No, I took it and it wouldn't take it. That's what it kept telling me at the bottom. That's why it was at C at the top now.
You marked Thomas Dudley absent?
Yeah, it is.
He's the only one absent there. I have updated since the conference came in.
Now scroll down. Waiting for Shirley to.
See? Logged in.
Kinzer doesn't have anything by her name, does she?
No, I said, I'm voting verbally because I'm logged in, but it won't let me vote.
Go back to Go back to
There it is. Yay, okay. What did you do?
I just clicked join meeting. I thought we did that before, but I'm not trying to change it.
You're good. Wait a minute, I can
No.
vote, actually, I'm gonna vote.
You have to click yes for Ms. Kinzer. She hasn't
Go
voted.
back to the list.
I'm on now.
There you go.
By Ms. Kinzer,
Then click yay. Now click save action. Now. There you go. All right.
School's been out a while, hasn't it, right? I hope so too.
Now take action on this one.
Have we have not voted on this yet,
Take
right,
action.
which I should be able to vote.
Click take action.
Is it still confused, everybody, because I've got everybody as yes.
but that was on the other one,
That's the consent agenda.
Oh, okay.
This is on the,
Look on the left-hand side where it says boys and girls.
Yeah.
Click on that,
girls, everyone is.
and it's still not. I just have to take action.
Take action, there you go.
There we go, we're back. Okay, who made the motion?
it's already, because the votes are already down. See, look, oh, I see, it's on the wrong side.
She hasn't selected, please vote now, yes, okay. But we haven't, no, she hasn't. Who made the motion? Ms. Parker?
Ms. Parker made the motion, and Mr. Fulbright seconded.
We're gonna have to go back to consent.
It looks to me like, okay, there you go, all right. It does. Okay, that motion does pass. All right, moving on. I'm sorry for all the confusion, but I think we're all ready to go here. The next is a new policy. It is policy number 2.902 about payment. It was, I think we did discuss it, didn't we, at the, or is this, yeah.
Hold on a second, Ms. Shirley, hold on, go back, please. Under 8.2 policies, there's 2.804 and 2.200. Those have to be voted on first.
Oh, yes, it does, excuse me.
That's okay, not a problem.
I think I'm gonna go home.
That's okay, you're good. It's all right.
Okay, 2.804 and policy 2.20 both need to be voted.
Click on 8.2, please, Shirley. Click cancel first, please. There you go.
All right, are we ready? Is there any discussion? We don't have a motion yet. Okay. We're what?
Motion to approve 2.804 and 2.200.
Okay, the motion's been made by Mr. Moore to accept the policy 2.902. No.
2.804 and 2.200, they're in the same one.
2.804 and 2.200. Is there a second?
Second.
Seconded by Mr. Beaver. Is there any discussion?
Mr. Moore can go first.
Mr. Moore.
Oh, sorry. I just want to clarify, these were ones that were added after the work session, correct?
That's correct.
And so, all right.
No, there.
I'm guessing they're on the agenda, maybe because you all have to vote on policies separately, but these are the same ones that we presented already at the work session. The expenditures and reimbursements, it's an old policy that's been approved. There was just a percentage that it's like, I think on one of the further pages down, that was 75%, but the 2/3 or that number was not correct, so that's the only fixing on that one. The 2.2, it just replaces mostly where it said the superintendent of schools will be responsible for the budget. It just says Director of Finance. And then the third one, the 2.902, is a policy where people can actually accept credit cards at school locations, et cetera, 'cause we couldn't accept credit cards before.
Okay, but I think all of you also saw information from Jake that the law says we can't. And it's the one that, will you speak to a 2.2? Yes.
Okay. I didn't know about that.
Is that all right with you, your motion?
I had no idea about that one.
It was a series of emails this afternoon. Oh, okay. Well, would you explain it?
Yeah, on 2.2, state law says that the superintendent is to prepare for 2.2, state law assigns the duty of preparing the initial budget to the superintendent, and, Dr. Marzak pointed that out on this policy, and I agree. State law requires that he be the person that submits that initial budget to you all. This policy says that that you, as the board, are delegating that to the finance director, and that's not appropriate. So that was the gist of those emails. Mr. Lucona is gonna send that back to the finance committee, make that change, and then bring it back to you in that changed form.
Then, can we remove that from your motion?
Yes, ma'am.
Ms. Harper?
Are these policies, they've already been approved by the Financial Management Board though, correct?
Yes.
So my question is, are we doing this with a posting for final approval next month, or are we waiving the posting requirement if they're already adopted by the Financial Management Board? I'm just curious if that's part of your motion or not, Mr. Moore.
At this point, I'm about ready to start over. We can amend the motion to remove the 2.200 as well as to waive posting. I'm okay with that.
Vote on the motion as amended then.
I think you just amended it.
He just amended
As
him.
long as my second.
Okay,
Yeah.
all right, okay. So we're only talking, I mean, we're waiving the policy just on that one. We're gonna, 2.2 will come back after he brings it to the financial. Mr. Moore, your light's on?
Yes, ma'am. So I guess I have the question, the issue with policy 2.200 comes up. Most of the times, it seems like we're kind of operating under the assumption it's been right. Who on the Financial Management Board side is checking these against state law?
I don't know.
Okay. I mean,
I'd have to
I would
ask
think
that
that would be
question.
something
Yeah.
moving forward that the Financial Management Board should be considering is actual state law in regards to what the
To
school
make
board's
sure, yeah.
responsibilities are. Because I'm pretty sure I've had this question a couple of times come up in regards to various policies and other things that have gone on with that. I feel like it gets thrown to us and, somebody really, before it comes to us, because we're being told that once it's passed the Financial Management Board, we just have to go along. Well,
Yeah.
clearly someone on the Financial Management Board should be checking these things against state law before they just
And
pass them.
Like I said, I wasn't aware of that conversation going on today, so I'll have to go back and double check as well, 'cause sometimes and this is just coming from back and forth with the Department of Education and the Comptroller's Office, they both don't agree with each other half the time either, so
Okay.
the state may say one thing from the Department of Ed, and then the Comptroller will come back and say something else, so I really don't know what's going on with that policy, but we'll get some clarification and send it out.
All right, thank you.
Is there any other discussion? All right, then we're ready to vote.
Shirley, go back up to the rationale again. It's motion to approve 2.804 only. Yes. And then put only at the end, please. Okay, got you. Thank you, Mr. Moore. Okay.
And that motion does pass. Okay, next on the agenda is a new policy. It is a policy about the forms of payment. This too has already been approved by the Financial Management Board.
Motion to approve and waive posting.
All right, is there a second to that motion?
Second.
Okay, Mr. Howell seconded the motion. Any discussion? Then we're ready to vote. And post immediately. Come. She's got in post immediately.
Yeah, waive post. Okay. So it automatically goes in the file.
And that motion does pass. Next on the agenda is the Superintendent's Evaluation. As per Dr. Marzak's contract, we are to evaluate him in June, and with agreement with him as well as with this board, we have agreed not to do that. But we need a motion. Mr. Moore?
Make a motion to waive our agreement to do a superintendent evaluation this year.
Second by Mr. Atkinson. Any discussion? Then we're ready to vote. And that motion does pass. Next on the agenda is finance and their budget amendments, some we didn't have for the work session. If you've had a chance to look at those, or if you have any questions, then Ms. Cox is here to answer them.
Motion to approve all budget amendments under 8.4.1.
Motion by Ms. Parker to approve all budget amendments from 8.4.1. Is there a second to that?
Second.
I heard Mr. Beaver first, so Mr. Beaver has seconded the motion. Any discussion? Okay, and that motion does pass. Next is zoning and facilities. First up is a repair of the compressor at Mount Pleasant High School. Mr. Pearman.
Good evening. This is a compressor in our main chiller down there. We've been watching it for a while. If we hadn't had the events of the last couple of months, we would have already had to replace it. We did not have it on the agenda a couple of weeks ago. We were still waiting on pricing. But the air conditioner cannot run without it.
Mr. Moore made a motion to approve. Is there a second to
Second.
the motion? Mr. Atkinson, any discussion? Then we're ready to vote. And that motion does pass. Next is security cameras. Let's speak to that.
Yes, ma'am. As we are not going to the Tendro conference this year, I believe I spoke, we were allocating that money to other, resources. Again, this wasn't on the agenda at the work session. We were waiting on our bids to come in. This will give us 33 cameras that we can supplement across the district. We have areas like the stairwells at Spring Hill High School that have never had a camera in them before, and this is gonna allow us to go into those untouched areas. I think we're gonna hit about 15 buildings actually with these 33 cameras, just filling gaps that we have across the district.
Mr. Atkinson made the motion to approve. Is there a second to the motion? Second. Mr. Howell seconded the motion. Is there any discussion? Then we're ready to vote. That motion does pass. Next on the agenda is a request to name the baseball field at Mount Pleasant High School. Is anyone here to speak to that? Mr. Pointer?
Good afternoon, Chairwoman.
What, Chair Kinzer?
Chair Kinzer, okay. And other board members. I'm just here really basically to answer any questions that you may have. We talked about this during the work study session regarding Coach Eddie Basham and the work and his body of work, which you should have contained in your packet.
Is there any discussion? Ms. Parker?
No discussion. I wanted to make a motion to approve this, but I was thinking that there was an issue with, potentially with the employment since he came back. If we need to waive that portion of the policy, I wanted to include that in the motion.
And so just so everyone is clear, I kind of brought it to everyone's attention so that there was not an issue later, that he did step in after a coach resigned and took over as a coach, which kind of messed up his years of how long he was retired from the school district, because we are paying him a check. But I think the consensus from the board was that because he stepped up, that wasn't actually, he was kind of volunteered to coach and we were paying a stipend versus him receiving benefits and things of that nature, that the two were not mutually the same.
And is that your motion to waive?
Yes, I just wanted to make sure that that part of the policy, we were waiving that portion, so there's not any, nobody can come back later and say that we weren't aware of that issue.
I think it's 3.210. I think that's correct. Do that from memory.
I'm as pretty.
Don't be that impressive.
Is there a second to the motion? Mr. Howell seconded the motion. Any discussion? Then we're ready to vote. That was pretty good timing, you walking in, wasn't it?
Yeah, he let me stand up here and do it all, and he sit back in the back.
Did it pass? We have to.
Yes.
Okay. All right, there's nothing under 8.6, correct? policy. All right, so then we'll go on to 8.7, and that's a update on the CARES Act. Dr. Woodard is here, and he has a guest with him.
Good evening, Chair Kinzer, Dr. Marzak, and members of the board. I have a brief proposal that I'd like to share with you tonight. But first, I want to give you a couple of minutes to kind of go through it, just a 2-minute silent review. And then that'll give us a little time to get set up, and then we'll briefly discuss it. And then I brought Dr. Cheney with me this afternoon to give you some feedback about the trends that we're seeing with the COVID-19 virus. He is the Chief Medical Officer at Murray Regional. So this time I'll let you all review, and then we'll get started.
This is a lot of information to review. I mean, I'd like to have time to
Yes, ma'am.
look it over. You're just giving it to us.
Kind of an overview. Yes, ma'am.
Okay.
Didn't want to overwhelm you with this quite a bit, but just want to give you a couple seconds to kind of browse it, and then I'll go through and talk about some of the parts of this, and then I'll turn it over to Dr. Cheney to discuss the trends that we're seeing with the virus.
Is this assuming that school would begin just, everybody goes back the first day, or is there a scheduling, anything that you're considering?
Yes, ma'am. Somewhere around page 4, I get to that. I'll go ahead and start so that you guys kind of have an idea of what we're looking at. First things first, districts all across the country are trying to figure out what is the best course of action to take with regard to starting school back due to COVID-19. As we all know, it's a global pandemic, and it has caused many deaths, and many people have been impacted by it. We also have many people who've lost their jobs due to companies downsizing, et cetera. So it's really had a detrimental impact on lots of people across the nation. And so school districts across the country are doing what we're doing. They're trying to figure out what is the best course of action to take, given the fact that we've had limited information from the Tennessee Department of Education. So we're trying to figure out what course to take. Some districts have jumped out there and put some things out, but the information has been limited. What I want to do tonight is give you a glimpse of what this will look like from the standpoint of being a parent. And I know some of you all have children, and you are parents and have children in Murray County schools, and some of you all have grandchildren in Murray County schools. But I wanted to walk you through this from the lens of being a prospective parent or grandparent who has children in this system, so that you will be informed about what school will look like as we call the new normal. So that's what this plan is, and that's what it looks like. And I will scroll along on the screen for the purpose of people who are in the audience behind me. But this is just a simple parent guide, a fall 2020 parent guide for establishing the new normal with regards to how we open school. First things first, we met with officials from Murray Regional Hospital last week. Dr. Cheney, Alan Watson, the CEO, and I brought members of my team. I brought Mr. Gaines, Laurie Stanton, Chris Pointer, and of course, myself, and we looked at 4 basic safety precautions that we think we need to take. One, we believe we need to have masks for our students as a protective barrier, and those masks should be worn during bus rides to school, during class change transitions, and in hallways. We're recommending cloth masks that are breathable and washable. Those will be sufficient. At this time, based upon the recommendation of our medical professionals, they do not recommend that students have medical-grade N95 masks, so we don't recommend those. But we also felt like students can feel free to have decorative masks as long as they meet the school dress code guidelines as long as they don't display anything such as drug, alcohol, or any other forms of prohibited content. We also are considering temperature scans in the schools. Daily temperature scans will be required for our students and also now for our employees, as this is becoming standard practice as a result of the disease. So we're looking at that. Also, we're taking the recommendation of the hospital with the philosophy of gel in and gel out. As students enter into the classroom, they would sanitize their hands, and upon leaving the classroom, they would sanitize their hands as well. And then, of course, the last precaution that we're taking, of course, is daily cleaning and sanitizing the common areas such as restrooms, cafeterias, office spaces, et cetera. These will be thoroughly cleaned each day up to the COVID standard. And moving on, this just kind of gives you an outline of each of the areas that we talked about and considered in our plan. And I think this is the part that you want to see. The team has discussed 3 possible school start scenarios. Scenario 1 will be August 3rd, that we start on time with a contingency plan for learning in the event that we go out for COVID-19. In the event that there's another spike in the disease, we have a contingency plan in place, and Mr. Gaines is going to talk about that a little later after I present. He's going to share a little bit of that. Option 2 is looking at August 13th, a delayed start. So that would look like we start 10 days later and using those 10 days to make sure that teachers are trained and ready to go in the event that we have to go out. And the last scenario will be a late start, based upon whatever we see with the disease, based upon what trends are showing, potentially starting after Labor Day. Schedule possibilities. And this answers your question, Ms. Kinzer. 3 potential possibilities. It could be all in, which means, we decide to start school and everybody comes. It could mean partial days, where we divide students up for half the day. One group will come for part of the day, another group comes the second part of the day. Or it could be an A-B rotation, where one group of students comes for a week and then another group of students will come for another week. Those are the kinds of discussions that we'd like to have your input in regarding what school is going to look like, again, as we try to establish the new normal with regard to school starting back in the fall. With regard to school buses, again, we are expecting students to, if they ride the buses, to wear a mask while on the bus. Again, that's to avoid possible exposure to COVID-19 due to close proximity, and that's also to protect them. So it's protect them from spreading the disease and from maybe getting the disease. School arrival, we're looking at screenings like I mentioned before. The next section is about the classroom gel in and gel out. With regard to masks being worn, students may wear the mask for the duration of time and at the level of comfort for each student. And also students and parents will also have the autonomy to decide the duration of the mask use. With regard to cafeteria and lunch, we know that things will look different with regard to cafeteria and lunches because, again, this is the new normal. Social distancing rules will be applied to school lunches so that we do not create hot zones due to numbers. And where applicable, lunches will be eaten in classrooms and also in other areas of the school with the discretion of the principal. So we're going to try to spread students out the best we can with regard to social distancing. But again, we do have to take into consideration what our cafeteria spaces and sizes look like and seating capacity. But we are going to try to make sure we maintain social distancing. With regard to hallways and restrooms, students will be required to wear a mask during hallway transitions between classes and also in restrooms. With regard to playgrounds and gymnasiums, social distancing protocols will be applied during recess and also during physical activity times as well. The key here is to try to alleviate large group gatherings with kids while they play, and to also make sure we maintain some semblance of social distancing in small groups while they play, et cetera. So, in terms of learning modalities, if we have to go out for emergency closure again due to COVID-19, and if we cannot provide direct instruction for students, we are preparing to make sure that we have distance and remote learning. And again, that part of the plan will be discussed with you in just a minute by Mr. Gaines. But we are working on using our CARES Act funding to ensure that we'll be ready in the event that we have to employ distance learning. With regard to athletics, on the week of June 8th, we will begin athletic conditioning, so students can condition. We have sent the rules of participation out to coaches, so coaches are aware of what those rules and guidelines are with regards to conditioning and getting back. However, there will be no contact until we give them the okay for contact. Full participation will resume once clearance has been granted by the recommendations of state and local health officials, also in cooperation with CSSAA guidelines as well. So we do have social distancing protocols with regard to athletic and extracurricular activities. And if parents want to see the athletic plan, that will be loaded on the website as well. Before and after care will be in session like normal. I spoke with the director of the Boys and Girls Club. They feel that they are ready, that they can meet safety protocols, and that they will be up and ready the day we start school back to provide those services to our parents in the community with regard to child care. And when we are out, they will also be out. And if we are out longer than they plan to open, they're going to let parents know that they will be at reopening and providing services at their location. And they'll let parents know which locations will be providing the services in the event that we're out long term. For students who may have pre-existing conditions, we've taken that into consideration also. We're asking parents to please report this information to the school so we can log that and provide us with any supporting documentation as well. With regard to cleaning and sanitizing, I want to salute Mr. Perriman and his crew. They've done an outstanding job. Our operations team has done a great job in making sure that buildings are cleaned and that they're properly maintained. So there will be daily inspections and detailed cleanings, which includes door handles, restrooms, classroom desks, offices, and all other high-traffic areas of the school. So that will be occurring also. So the next part of this, what do we do if we have a kid that we suspect has COVID-19? Because we can count on this. It will happen. Okay, the honest answer is that it will happen. So what do? What is our response if we think we have a kid in school that is symptomatic of COVID-19? So number one, we're going to be doing temperature scans. And so when we have students who are above 100.3, those students will be sent to an isolation area to be seen by a nurse or another certified staff member. The school nurse will provide an assessment to check for COVID symptoms. If coronavirus symptoms are present, the parent will be expected to report to the Maury County Health Department or to a private physician or so to get a health screening. The student can return once we have indication that they have been cleared by a medical professional. We're also looking at doing a little bit of contact tracing, and we're asking for parents to also have their siblings tested as well. We know that if you're in the same household and if we have a child that may be symptomatic, we're also asking parents to check with the siblings just so we can be sure. The last thing is that we expect for the health department to do the contact tracing, and they will be making an effort to find out who the children have been around in the event that they have the symptoms of COVID-19. Here on the page, we also have some resources for parents. There's a lot of misinformation out there about the disease and what's going on, so we've included some resources for parents in case they want to know more about the disease. And at the very bottom here, if you look here at the very bottom, I'm going to make this a little bit bigger. You can see that here in our county, our population is about 92,000. We have 92,000 people here in Maury County. And in terms of the number of cases, as of May 30th, we had 89 cases, so that's less than 1%. So we're at 0.0965% in terms of cases. However, that's misleading. At any given time, that can change, and again, we can have an infectious spread, so we have to be ready. Also, special considerations. I took the time to meet with principals last week and also talk to parents and one set of parents anyway about some of this and just to get some feedback. So here's what we've decided. We're going to postpone open house and other mass gatherings. We plan to postpone parent-teacher conferences for now. Also, we're going to continue to work on grades, report cards and grades, and what that's going to look like in the remote learning environment. That's still going to be a work in progress for us because it's new territory. We're also going to be working on dual enrollment and dual credit. In the event that the colleges start back before we start back, it means that our students who are dually enrolled will be a little bit behind. Typically, we start about the same time, so we're concerned about that. But we're hearing that some of the colleges may start back in July, which means that they could be 3-4 weeks in, and then our kids will be behind on that content. And we want to make sure that our kids are, at about the same level. So that's a concern that we have, and we'll be working with Columbia State on that. Grandparents' Day, we're going to move that to spring semester if conditions improve. Also, parents at times like to eat with their children. We're going to stop that practice for now. And we will allow that once we have further notice that the curve is flattening. But for now, we're not going to allow that practice. Parties and celebrations in classrooms, those are going to be suspended until further notice. Games for fall sports, that's going to be undecided. We do believe that football, volleyball, soccer schedules will be altered due to travel distancing, and they may even draw up new regions and things like that. Due to COVID-19, so we're still waiting to hear more about what games will look like. So right now, we have an undecided there. Large gatherings, such as pep rallies in schools, will be suspended until further notice. Fall carnivals and harvest festivals, that decision will be made based upon what the conditions look like. We're suspending field trips for now until further notice, and we have also moved the immunization deadline back until October the 2nd. Typically, we want immunizations done by August 1st, and we're going to give parents a little bit of grace on that, and then have those done by October the 2nd. Fire drills and emergency evacuations will be the same as normal, with some semblance of social distancing where possible, as students are outside. It'll be very hard, of course, to have social distancing when kids are evacuating the building, but once they're outside, we will try to space kids out appropriately. The next component of this is about digital learning. Here we have some recommendations for parents with regard to what to buy. We are asking parents to partner with this with regard to digital learning. So we have some recommendations, and you'll hear more about that in the CARES Act application. For grades K through 2, we're asking parents to look at the iPads. For grades 3 through 8, the Chromebook, and for grades 9 through 12, we're looking at a Windows-type laptop. Protective cases are recommended, but they're not required. We also have a map here for parents of the hotspots and where the locations are in the community, so they can see based upon where they live, where they can get Wi-Fi access. So that's in here as well, so parents would know that. Also, we have a general recommendation supply list, what we call the Big Five. These are the 5 things that we're generally asking parents to purchase. 5 things. 1, a cloth mask, that's washable. 2, hand sanitizer. 3, sanitizing wipes. 4, a digital learning device. And also in the fine print here, we said that if feasible within your budget, it is recommended, not required, and that devices will be available at schools. Number 5, we're asking for Kleenex tissues. And then, of course, we just have some information at the bottom of this that tells them who to call if they have questions. Last but not least, in this document for parents, it is a special thanks to all of our community partners for those who've been extremely helpful and those who've supported our efforts during the crisis. And we want to send a huge shout out to Murray County McDonald's, Target Superstore, the Youth Ed Foundation, Sonic Drive-In, the Murray County Boys and Girls Club, the Murray County Sheriff's Department, Murray Regional Hospital, the Office of Emergency Management, Murray County Health Department, and the Murray Alliance. So these are some of the partners. We wanted to ensure that our parents knew who was wrapping their arms and supporting kids during this time, which agencies in our community were supporting kids during this difficult time. And so that's why this is here. And we also want to thank our faith-based community as well. And I have information about thanking our faith-based partners in this box as well. So this is just a quick, handy-dandy guide for parents that we thought would give them an idea of what school would look like in the new normal. We've worked extremely hard on this document, and I'm willing to accept your feedback or any pushback that you may have. And I want you to know also that we feel that we've given more detail than any other district has given. We've looked at the plans in other districts, and they're very, very basic. And we feel that we're giving parents much more detail and information with regard to what the new normal would look like in this county as opposed to what we're seeing in other districts. At this time, I will stop talking, and I'd like to ask Dr. Cheney to give you some information about what Murray Regional is seeing in the disease, with regard to the disease, and then give you a chance to ask any questions of him that you may want to ask. Dr. Cheney?
Yep, thank you. Yes, sir. Thank you all for having me, for Dr. Witter for asking me to come. I'm a board-certified pediatrician, so the well-being and care of children is very important to me. Fortunately, we don't see a lot of children in the hospital with this disease, which is very good. So I have a vested interest, however, in rolling out the school year because we do think, if anybody knows about how this virus is spread, that children can spread this virus very rapidly. And I'm not as concerned about children themselves, although there are a few vulnerable children with asthma and certain respiratory diseases that might be at risk of severe disease, but children could pass it very quickly to their parents and grandparents, and it could get into very vulnerable populations, the elderly or nursing facilities, skilled nursing facilities, and then it becomes a bad day for me at the hospital. So, you know, I have a very sincere interest in seeing that this gets rolled out and that you protect what I consider super spreader events from happening. So if you look at how this virus spreads, you know, right now we're kind of seeing a case here, a case there, and actually in Murray County since yesterday, your numbers, we have 99 now, so we've increased 10. And so that's 10 cases over the course since March the 4th or 8th when they started counting. So we've gone up 10% total in 3 months in just the past 24 hours, which is not surprising after Memorial Day weekend to me. at all. But, super spreader events are well-known clusters that occur from one infected individual, of course, that infects a lot of people. And the greatest super spreader event that's been traced so far is where one individual that was symptomatic gave it in a course of 4 hours to 355 other people. So these things can occur. These are usually very symptomatic individuals. The coronavirus, in most of our models were based on influenza, which is predominantly an upper airway disease, can affect the lungs. We can cough some from it, but a lot of the cough from influenza is cause of throat irritation. Coronavirus is a lower respiratory tract disease. So when you cough with coronavirus, you really put it out in little droplets. And those droplets, of course, get in the air. They can live for a while, especially in stagnant rooms where there's not good airflow. And then they settle. They settle on whatever the child is coughing on, the desk, the doorknobs, their hand. They touch the doorknob, and then, of course, everybody goes behind them, touches that same thing, touches their face. So we really would not like a super spreader event to occur in the schools, and we've talked a lot in this policy about how to prevent that. You're not going to prevent every infection from happening. I just think that's almost impossible. If everyone was symptomatic from this disease, you could probably come close to preventing it. But as we all know, especially in children, about 4 out of 10 that would have it are completely asymptomatic, maybe even more, which means there'll be kids that are infected that you don't even know it, and they could be spreading it, and that's why it's impossible to prevent it. What we need to avoid is one child spreading it to 100 other people on the bus or on the playground or in the cafeteria. And so these guidelines that we went through are really to prevent that from happening. It's cleansing the environment often and frequently between classes. It's masks. Remember, this mask I'm wearing is not to protect me from you. It's to protect you from me. So I'm wearing this because if I'm one of those people and I don't think I've got it or I don't know I've got it and I'm coughing and I'm touching stuff, I'm spreading it. So I'm wearing the mask to protect you. And so the message has to be, and we have signs in the hospital going up to express that sentiment right now, that it's important that kids mask on the bus when they're congregated in areas, because that will help keep an infected individual that doesn't know it from spreading it to other people. And then the third thing is identifying kids that are symptomatic and get them out of there to the best of your ability. And I know child care is an issue. You know, where you send these kids, how do you screen them? That's a challenge for you all. And each school will probably be a little different in that, and each family. But symptomatic kids need to get out away from everyone else until they're tested. Right now, we're not seeing influenza. We're not seeing other cold viruses go through the community. But when school starts back in session, all of those normal things that we see that cause kids to get snots and coughs and everything else, and every child gets at least one respiratory illness in the course of a winter, that's almost average, they're going to start back. And so you're going to have to figure out, is this rhinovirus, is this influenza, or is this coronavirus? And you're going to have to get these kids out, get them tested. We're getting better testing. Within a day or two, usually you know the results. And if it's negative for corona and they're symptomatic, I have no problem. That child, you know, if they're sick from other things, they probably still need to stay home, but they can transition back quicker. If they're positive for coronavirus, you know, the CDC guidelines out there, they're out 10 days from the time their symptoms stop. Actually, from the time their symptoms start, they're out 10 days, and at least 3 days after their symptoms are all gone. So you're looking at kids that will need an alternative learning environment at home, or there are going to be big gaps. And the quarantine thing is also significant, because kids that are exposed, if a sibling is positive but they're not yet positive, you quarantine them for 14 days. So they have to stay out of your school for 14 days. And that's clear CDC guidelines, and that's what we're even practicing with our employees in the hospital that are exposed. And it creates significant staffing, a nightmare at times for you all. So I'm here to answer any questions you may have. I don't envy your decisions and position, but I do think it can be done. safely, with attention to these details.
I believe Mr. Fulbright like to come first, but,
Thanks for being here. This is actually probably for both of you. I've got a whole list here. Just from some of the wording that was in the document, I'm assuming this isn't a year-long plan. Because a lot of it said to be evaluated depending on the situation. What are gonna be the metrics? Who's gonna set the determination of when these restrictions, these impositions are lifted?
I can tackle that from a medical standpoint, but you can do it from an administrative standpoint.
You go ahead.
Well, I can't answer your question. Nobody can answer your question.
We're not gonna have any kind of milestones to let us know when we're gonna back off of this?
Well, I think if we have no infections in the community still occurring in the United States and in certainly our state and our area, we will be able to back off. I get the same question asked at the hospital all the time, how long are we gonna mask? How long are we gonna pre-op test people? And we're doing a lot of testing, we're not getting many positives, but it only takes one positive to really change the culture quickly. I am telling most of my colleagues at the hospital, expect to mask in the hospital through the end of this year, and that we will reassess come January where we are as a nation, where we are as, if there's a medication that can be found that stops severe disease and stops people from dying. If we can get to that point, let everybody get infected, because then we don't have to worry about, the bad outcomes, and we'll get the herd immunity that you hear about pretty quickly. But until we have that, if it spreads to the community, it's a very dangerous virus.
Okay, so from a school system perspective, what are we gonna look at?
That's a great question, Mr. Fulbright. So, from our perspective, we want to make sure that we stay in contact with local health officials, and also follow CDC guidelines. As they say that things are lightening, as they let us know that things are improving, then we want to begin lightening up as well, allowing, larger gatherings, having festivals. We don't want school to be a miserable experience under the new normal, but unfortunately, until things improve, we just don't know, and we don't want to take those risks. And we don't want to, we want to try to mitigate those risks for the sake of the board as well.
So, listening to what I've just heard.
Yes, sir.
These restrictions will be in place until the virus is eliminated from the state or the country, or there's a vaccine?
No, not necessarily a vaccine, but a treatment. I'm more faithful in a medication rather than a vaccine.
Okay.
Our way out.
So I did hear that right. How will this be enforced? Is there gonna be in-school suspension for someone who doesn't wear a mask walking to the bathroom?
Great question. We thought about those situations also. We wanted to provide some of those disposable masks on buses and also at the school, so we can give a kid a mask. But again, if we have a kid who is defiant, we'd handle that the way we would any other disciplinary issue. But it would be, an expectation.
Okay.
Yes, sir.
Does the board have to approve this? I mean, I'm not saying do we have to yes or no, but does it go through board approval process for policy?
Well, that gets tricky. There's always the age-old debate about what is management versus what the board will govern. I'm bringing this to you all today to kind of hopefully get your input, but I do believe that we need to implement some quarantine policies. We need to think about how we're gonna handle cases, because what if we do get a kid that has symptoms, and if we don't have anything in policy that will mandate them staying out, how do we tell a parent they can't bring the kids back to school? Or a policy that mandates that they go get tested? Then if we don't do that, then parents will not get tested, even if our nurses and our professional staff see the symptoms. So we will need some policies around this. We're not quite at the point where we're ready to draft that language. We're getting there. But we do want your support in this, and we want your full support before we put this out publicly. One more thing I want to say. One of the things that we have seen with this disease is that it has divided our country, even along political lines. There are those who believe that things are lightening and improving and we can get back to normal. And then there are those who believe that this is the worst thing ever. And so it's difficult. And we have that same level of concern in our community. There are people in the community who think that, hey, things are getting back to normal and it's great. And then we have people who, you know, are really, really worried about this. And so what we're trying to do is let parents know that we're taking every measure that we can to ensure a safe, clean environment under a situation that is deadly. So we're taking every precaution that we can, and again, we're trying to mitigate risk. So, again, I welcome the hard questions and the feedback.
I've got one more.
Yes, sir.
If the kids were back in school today, they would be following a policy like this or one similar, with the mask and the washing and every 6 feet distance?
As we'll social distance the best we can, given the state of where we
Well,
are.
and I'm asking that for a reason, because kids, if they were in school today, would have had a mask on between classes, even during classes if so desired. And I'm looking around here right now, and I see one mask. So we're not adhering to this policy at all. I'm sitting here 2 feet away from you two are standing shoulder to shoulder. So, I mean, it's one thing these are great recommendations, but for us to say that we're gonna implement this on somebody else and we're not doing it ourselves, I think from now on at every board meeting, we ought to be wearing masks. And we should totally redesign this up here, so we're all 6 feet away from each other. I think that just shows a little bit of thank you.
Miss, I believe you had your light on first, and thank you for turning it off, so, but you can turn yours off.
Oh, okay. Thank you for being here. That was one of the things I was gonna say, just with everything, trying to, get it done and, moving forward, it is tricky for everybody on both sides. But, when we talk about the bus ride and the mask and that kind of thing, and, you know, children, they're just children.
Yep.
And, I watched it when I was gone in stores and things, and you have to see parents be like, yeah, where's your mask, or whatever like that.
Mm-hmm.
But, some of them shy away because they don't understand all what's going on. Some of them think it's cool, look at my mask, or something like, I ain't wearing no mask. And so, but on the bus rides, I can just see that being a place where they wouldn't wear them, and that's a place where they're really able to be, they don't have to be apart, and they're on the seats and things like that. So they probably, you know, and the kids just get in each other's face, they talk, and then they're just in their world of social, that's their time of social, time, so they would be, I don't think the mask would work there. And then my other thing was the temperature scans. If we were doing that for every child, are we gonna have like multiple places to do it at, because that would be time consuming as well on one person, or wherever the scan point is going to be, or would that be like a multiple thing time-wise, even for the employees to be able to do it, and school starts at 7:45, but if you gotta get in the building at 7:45, how would we conduct that scan?
So the plan that you see is more of the what, and then there's another plan that my staff will have, principals will get, et cetera, that explains more of the how. It gets deeper into the weeds about how we, plan to do this. We're in the process of trying to order more. We have 50 in our possession now, and Mr. Perryman, correct me if I'm wrong, you're getting another 100, correct? Mr. Perryman is getting another 100. I'm also placing an order for more, so we're gonna have several of those in the schools. And, those scans are pretty quick. Infrared scans are pretty quick, 3 or 4 seconds per child, and they give us a quick read. We're hoping that those will be accurate. We know there are things that also can, skew those results, but we're hoping that they will be, pretty accurate. And we're gonna use a pretty reputable brand. One of the brands is iHealth, and another one is, I can't think of the name, but it is FDA approved. But those are the two brands that we're looking at, and we're keeping costs pretty low with regard to ordering those. They cost, somewhere between 40 and 60 per scanner, but we're looking to acquire those. And many of the ones we've gotten already have been given to us at no cost, I believe, from the Office of Emergency Management. So many have already been given to us at no cost. So we are being fiscally responsible with that. But, we think it's a measure that we need to take. And again, this is designed with, the responsibility of showing our taxpayers that we're trying to keep their kids safe. I know that, again, there's nothing like this issue that has divided this community. It's divided the country. But, you know, I believe that we have the responsibility of showing people who are worried about this, who are nervous and terrified about sending their kids to school, that we're taking these measures to keep their kids safe. And, you know, these are recommendations from the top officials at Murray Regional.
Mr. Moore?
If a student, tests positive after the, time that they're out, will they have to take another test before they come back in? Or is it just a time period?
Yeah, no, ma'am, it's, the CDC guidelines are pretty clear now.
Okay.
It's 10 days from the onset of your symptoms. As long as you've been symptom-free for 3 days, you can come back.
Okay, thank you.
That, well, I don't want to get into science too much, but if you continue to test, you might get positives, but the student will no longer be infectious to others. There could be remnants of viral particles that get tested, and so they don't recommend retesting now. Just symptoms, if you've cleared your symptoms, you're usually good to go.
Mr. Moore?
All right, where do we want to start?
Uh-oh.
I will start with, well, to get to something Mr. Fulbright was saying, I mean, we're already arbitrarily addressing CDC guidelines as it is. So I don't put a lot, when we say we're adhering to those, we can't. I mean, I've read through the entire guidelines that they put out for schools, and most of those are absurd on their face. So I'll just say it this way. There's a couple of these. Most of this stuff I will in no way support as a board member, ever. Some of this stuff is crazy. We are taking the wrong approach here. We are doing a shotgun approach when we should be doing a target approach at-risk people. And we should not be impacting the entire school system, forcing every child to wear a mask, which, by the way, my children are not going to wear masks going to school. I can tell you that right now. Well, it may come to that. So, I'm not, and this isn't directed at you, but at some point, some of this needs to stop. I can guarantee when you guys went through this, and I know a lot of work went into this, but everybody is operating on a mindset that we have to do something. And I don't think, some of these things are just crazy. And I can't be the only person sitting here that thinks that some of these are just insane that we're going to ask our children to do. And again, we have zero proof that it's actually going to change anything or impact anything. We're just going to do it. And some of these things are very expensive, by the way. When you start looking at some of the costs of some of the cleaning measures, I know we talked a little bit about that a week or two ago in a meeting. For us to actually get to the cleaning measures at the CDC recommended levels, we're talking millions of dollars, because our regular cleaning contract is not going to come anywhere near touching this. So these are, again, handing masks out to students, making sure staffing can handle this stuff. I'll tell you what scares me when we're talking about a nurse or a qualified individual that's going to be making medical decisions at the front door of a school when someone comes in with a temperature. I don't even know, what are we getting into here? So, I mean, do we need to have multiple nurses at every single school to handle this? Or do we just have a principal that's going to be taking temperatures and making that call? I think we're getting into a whole world of decisions that, again, I am happy if we start to shift this back to the individual and not take this on as a school district. We're trying to solve all of these problems, because at the core of this are at-risk people, and everyone is not at risk. And at some point, we have to shift that to those people. And if someone is at risk, I would like to see us address this with students. I mean, I'd like to see a plan that talks about students that are not comfortable coming into a mass gathering of their school. We need to address learning for those kids. I mean, that's an important thing I think we need to do. But that's not every child. And when we've got staff members that don't want to come in and don't feel comfortable, or maybe they have health issues that they don't want to be or should not be teaching in front of a classroom, we need to address that. I want to see plans on that. But addressing the entire school, just trying to hope we catch something, I'm just not going to agree to almost any of this.
Mr. Moore, I appreciate your respectful pushback, and as you know, I'm a nudge back at you a little bit, okay? You have a medical professional here who is telling this board that he believes that if we don't take these precautions, we could have a serious infectious spread in our school system, that we will be creating hot zones in our school system that will then turn Murray County into hot zones. You have a medical professional here telling you that. I don't know how we ignore that kind of advice and then hold the onus of protecting our kids in the community and doing our due diligence of protecting the kids in the community. And again, people are paranoid about this disease. People are afraid to send their kids to school. And so until we show them that we're taking the appropriate precautions, they're going to be terrified. Kids don't come to school, we lose BEP dollars also. It's a funding issue. Not that it's about the money, but I'm just saying that is one of the implications of people don't send their kids to school. I have heard that people are saying, I'm not sending my kids to school. I'm terrified, okay? So we're hearing these kinds of things. So we want to alleviate the panic. We put good resources in this document that will give parents good information about what is really happening with the disease, so we can ease some of the fears that are out there in the community. I get your concerns. I totally see where you're coming from. Sometimes it does feel like it's much to do about nothing. I get that. But I don't know how we ignore the advice of a medical professional like the man that's standing to my right, who is telling us that this thing could take off in this county. And then again, how do we mitigate that risk? That's the key. This is really about mitigating risk. You know, I promise you, there's no one who wants football back more than me.
Dr. Woodard, if you don't mind on that.
Yes, sir.
Two things on that. You said it several times there. You're talking about mitigating fear, not a disease. You said it about 7 times, actually, if I'm counting correctly.
Okay.
That's fear. There's no way to mitigate that. It can't be. On top of that, and with all due respect to the doctor, I don't know his credentials. I don't know him personally.
Yes.
But every person in this room ignores doctor's orders every single day of their life. And sometimes with good cause. So he'll have to excuse me if I'm not going to just blanketly accept that. But we all do it, and it's a choice we make. And again, as a school board member, I am perfectly comfortable in this case ignoring some of those orders.
I respect it. Thank you.
Okay, Mr. Howell had his light on.
So I've got a couple of questions myself. How many nurses do we have across the district? 16. 13 full-time, 3 part-time. Okay, and we have 22 schools, right. So already, we're going to have to hire some more nurses. And that's assuming that they come into Horso Porter today, and the nurse, I'm assuming, is not going to be the one scanning. You're going to have someone scanning while the nurse evaluates. Well, now we've got a line of 10 kids out here who have got a temperature. Are they going to sit there till 12 o'clock while she evaluates one at a time? I mean, I don't think we're staffed. I don't think this is an adequate. I don't think we're anywhere near staffed to be able to handle this. Another thing is if we go back to the possible school start scenarios, you mentioned training in here for distance learning, how that's going to look. Just curious as to what kind of training is that? Is that in person or is that online?
It would be a blend of both, in person and also some webinars and online, yes.
Why are we not offering this right now? Like, why are we trying to delay schools? Why are we not offering this?
Okay.
Yeah, absolutely. I understand vacations, but I
Teachers
mean,
are
if
not
we
under
offer it in
contract.
June, July, I'm not making it mandatory. It's voluntary. No?
Well, they're
It's
no.
well, we can offer it. I'm not saying they have to take it right now.
We'll be using
It is being offered right now?
some.
Okay.
I offered a webinar
Some.
last week, to all middle and elementary schools, and we had 54 people show up.
Okay.
So, yeah.
Okay. I wasn't aware of that.
Yep.
The other one is for CARES funding, so I'll wait on that one. Thank you.
Yes, sir, thank you.
Anyone else? Mr. Fulbright?
I actually have a nice question this time. On the opening of school, whether or not it's delayed or not, what will be the determining factor of whether the delay takes place?
We're hoping for your approval to set that date. August 13th was the date that we were hoping for, if the late start was the choice. But if all the time,
I guess I'm asking, what will the criteria be to make that judgment?
I'm not sure I understand what you're asking.
Well, I mean, we've got 3 options: August 3rd, August 13th, or whatever.
September 8th.
What are we using to judge which of those 3?
Okay, the 13th was the date that we chose, which is 10 days past the standard school start date, so that we'd have time to train teachers. So in the event that there's a spike in the disease and we have to go out again at the request of the governor, we'd be ready this time. That's what that date.
So that would be pretty much taking cues from the governor or the Department of Education.
That would be, that's why we chose
Okay.
that date.
Thank you.
Yes, sir.
Mr. Sims?
Guess my question's for the doctor. In your opinion, is the virus going anywhere long-term, or do you see this virus being with us from now on?
This is becoming an endemic virus and not just a pandemic virus. Pandemic, of course, comes out quickly. Nobody has immunity to it. Lots of people get sick. You either die or survive it, and it goes away. But I do think that the social distancing that was put in place has, as we've heard, flattened the curve. I mean, there's no doubt that what happened in New York and these places has not happened everywhere else. And there may be some mitigating strains of the virus and such that we're seeing some changes in the potency of the virus, the virulence of it, which I'm certainly hoping and praying for. And I hear you guys. I'm probably with you more in thought, but I also have a public trust at the hospital that, for patients that come into our hospital, and it's very similar, I think, to your students coming to your schools. Even the CDC guidelines, if you read all those like you say you have, they don't talk about preventing infections, they talk about slowing the spread. And really what this is about to me is slowing the spread. We're not gonna prevent them all. We just don't need every kid getting sick at once. And this virus could get every kid sick at once. It can do it. It's done it throughout the world, enough places that we can't just ignore the fact that you could have one school with 400 kids. We had one prison that has 1,200 prisoners that are positive. Now granted, they're young men mostly in that prison, and there have not been a lot of deaths and a lot of hospitalizations, but nonetheless, it's a reflection of the community and the risk to other people in those vulnerable populations. So I do think it's gonna be here a long time. If there's not a medication, if there's not a vaccine, probably everybody's gonna get it eventually. My stance is we just don't need everybody getting it at once. You saw enough people like in New York get it at once that it overwhelms the system quickly. So I'm for common sense things, washing your hands before you go into a classroom, teaching kids good hygiene, don't get each other, don't cough in each other's faces. These are things we know about from the flu. This is nothing new. It's just that this virus spreads more easily than the flu. The average person with the flu infects 3 other people. If there's no social distancing, the average person with corona infects 10 other people. So it is more contagious, and it can spread like wildfire very quickly. So I get your points. We do have some social responsibility, I think, to our fellow citizens to, if we're sick, don't go and spread it to other people, and we gotta teach kids that social responsibility from the very start. And I think that's where I stand on this.
Well, and that's kind of what I was getting at. I've heard other, which media take it what it is, I guess, but, doctors on the media saying it's here to stay. We have roughly 100,000 people, only 100 have it in a 3-month period. We're looking at the rest of our lifetime being in isolation if we are trying to slow the spread. So at what point do we just say we've got to go for it? I'm not saying I'm just talking.
I hope you're saying.
But I may be. But anyway, I mean, do you know the statistics on just locally suicide rate in Murray County?
Yeah, no,
It's
I'm not
There's
for
more
the
suicide
stay at home,
during
do
this
nothing.
than corona deaths in Murray County.
Yeah.
And so we have to look at lots of other things than just the sickness of the coronavirus.
Yeah, I'm not saying stay at home, or otherwise we wouldn't even be talking about this, right? Because we're still stay-at-home order, which has led, I think, to the depression and isolation people have felt. That's not this plan. This plan is getting kids back in school into an environment where you protect as many people as you can with common sense things. And a mask, I mean, I've been wearing them for 3 months now straight. Kids get used to it. It can be taught. There's enforcement issues on those, but.
Mr. Moore?
Okay, I'll circle this back around to productive discussion here, if you real quick, because I know we've kind of talked over an FYI thing for quite a bit. A couple things I would like to see as a board member moving up. One, I would definitely like to have a further discussion with Jake about the legal responsibilities about who makes these decisions. I mean, while there may be some gray area in terms of that, if this has the gravity that you guys feel like it has, then absolutely, I think this is something the board should be deciding and not staff. but I'd like to discuss that further as we get into this. Or to be honest, on almost any more adjustments. I know I brought this up when we closed school early about who should have been making that call, and I still feel like the board should have made that call ultimately, but that's water under the bridge. I would like, and again, as we move ahead as a school system, I would rather we focus again on, instead of leading off with comments like, new normal, I think it's important that as a school system we move towards a more positive approach of stability and actual normalcy, not new normal. Now I know that may look different, but I definitely think that needs to be our focus as we lead our community into a stable direction. Third on that too, I absolutely want us to have more discussions on this before it goes any further. I think this is just something that if it is, again, a heavy enough subject that we are talking about completely modifying the school year and the day-to-day activities of every student in this district, we definitely need to have more if that means special call meetings or whatever that means, work sessions, I don't care. But I think if that's where we're at, then we need to be discussing this in heavy detail. Thank you.
I think that we would have to vote if the calendar was changed. I think that's where that comes in. The board would, any change in the calendar would take board approval. Is there any other discussion? Excuse me, I'm sorry. Go ahead.
Are we gonna hear from Mr. Gaines about funding? Okay, I just wanna make sure.
All right, next. All right, go ahead.
Just a final thought. Thank all of you. I want to thank all of you guys for your feedback and your pushback. You all know I'm a fan of respectful pushback, and I think that when we push on each other, and iron sharpens iron, and so we have a community who is eager and waiting to know what direction we're going to move in. So we do need to make some decisions pretty quickly with regards to what the opening of a school will look like. And I'd love for you to take this proposal home, think about it, look at it, read it, and let me know your thoughts. Email me your thoughts. Me and my team, we have wrestled over this quite a bit, and we've pushed each other very hard over this. And what we boiled this down to at the end was, how do we ensure taxpaying citizens that we have a safe environment for them to bring their children back to at the start of school? And that's where these recommendations come in, and hearing what our medical professionals said has resonated heavily with the decisions that we've made on this. So thank you, and I appreciate the opportunity. Thank you.
Thank you, Doctor, and thank you, Dr. Cheney. Appreciate it. Next, Mr. Gaines is going to talk to us about the CARES Act.
So as you know, we've been in conversation about the amount of funds we have, and I think we had some work sessions. We did have some work sessions with some board members and kind of got some guidance on some spending priorities. Since then, we received some updated information. We sent that out. I don't know if any of y'all watched the webinar. The PowerPoint was probably easier just to look at. One of the things it did note that, at least 80 to 85% of the funds should be spent on the priorities of reopening of schools and continuous learning. So with that fact, we are still developing the plan. We have a draft budget according to those focus areas that we can send to you to just say, right now it's just numbers, but we'd like to have another work session where we can talk with you and say, okay, here's our rationale behind why we have this much funding here, why we have these things there, so that we can have time to talk and really dig into those. I think all of these things connect together. It was important for us to kind of visualize reopening because part of the CARES Act funding, like you said, so if we need to sanitize, do we need additional funds? Do we need to set aside some CARES Act funds for that? Do we have funds available? All of those things will have impact. If we have to buy additional gloves or masks or anything like that, those things might be part of something we could fund in the CARES Act. And like everyone says, that money's not going to go a long way, but it will help us to reopen. But our focus has been on the continual learning plan. We do have some, so if we delayed school, we have some 10-day plans we're also looking at. So if we do come back to school fully and there are no restrictions, how can we still train teachers for the continuous learning? We want to bring to you what type of things we're thinking about purchasing so that we will have something so that students and teachers will be able to continue learning. But I think all of those bear further conversations, but just to say we have We've done some more with the budget. We want to present that to you. We've also reached out to principals and given them the priority areas, and we're getting input from them. All that's going to come back to us this week, and we're going to relook at that, make sure we haven't missed anything from the school standpoint, and continue to refine that plan.
How soon would you be ready to have a sit-down work session on all of this?
Thursday?
Thursday.
Wednesday? Thursday?
Well, we have a budget meeting Wednesday.
I don't know how, yeah, it can be however y'all want to do it. We could be ready by, we're working on the language of the continual learning plan, and that will still continue to go as we continue to work on that. So we can share what we have so far, we can share the draft budget, and we can be able to have some discussion about that.
Our work session is 2 weeks from today. Could we just do it at that time? Would you be ready to go then?
We have an application deadline of June 15th,
right.
so we'll have to get some more guidance as to go forward after that, so we'll kind of know and kind of bring back to you. My thoughts are even at some point, we will present to you a draft budget. It will go to the state. Once that budget is approved, we'll have to come back to you, maybe in a special call meeting or something, just to add those funds to the budget. I think they are going to be in 21, so we may have a little more time once it's approved by the state. Sort of like what we do in the consolidated application. We present you a draft budget and say, hey, it's at the state being approved. Once it comes back, we'll finalize it, and then we'll move forward. But I think it's important that we know where our priority of funding are and where those funds are going.
I think perhaps we could schedule a work session next week, later in the week, the Wednesday or Thursday of that week.
And it could be as simple as us sharing information by Zoom, or if we want to social distance and come here, we're happy to do that and just share where we are.
Do it by Zoom.
Okay. Set up a
Is that
Zoom
all right
meeting
with you
Thursday
all?
sometime?
On that Thursday. We've got a lot of other things pending.
Yes, son.
Budget, and, at some point, we'll have to have a call special to approve a budget. But this is really important. So
Right.
let's just plan for that Thursday night or Wednesday,
Or if it's a Zoom session, whenever y'all want to, what's good for you guys, we'll try to accommodate it. It's probably this Thursday where we
Let's
can.
do it this Thursday. The only thing, I have financial management, I was gonna stay for budget, but I'd love an excuse not to do that.
Whatever's fine.
I'll be through with financial management by 5:30.
Do we want to? So we'll try to
But
be
you
here.
could definitely start the meeting, and I'll just join it when
Okay.
I can.
We can have it Zoom, or we can broadcast from here, I guess. Can we? We did the Zoom meeting from here before.
Yes.
Yeah. So if people want to come and listen, we would be here.
Can you get us some of your documentation prior to that?
Yes. Yes. I'll send the draft budget, what we have on the continual learning plan. Well, I will send the draft budget, what we have planned for the PD plan, and you already have the digital learning plan. We'll send those 2 documents.
If you can also keep us updated on the timelines that are
Okay.
the key dates that are coming up, because I know there's
Okay.
a couple of them.
Okay. Well, this will be a work session, not a voting as it is.
no,
So
I
you're saying you're gonna have it here for
Yeah.
those that want to come here,
Mhm.
or if any of you all want to join by Zoom, you can do that
Right.
also.
Yeah. I think it'll just be informal work session, like we did before, the last Friday.
If I can interject on that, I really appreciate the opportunity to sit in on that. It was very helpful for me to see how you guys collaborate, so
Yeah.
probably the best thing that's come out of all this was being able to sit in on a meeting like that, so thank you.
Okay.
You guys
Mhm.
did a good job with it.
Thank you.
Let me ask the board, are you all a Zoom meeting, or do you want all come here, or just choose to be one way or the other? Choose. Okay, all right. I'll be somewhere. Okay.
Okay, one more question?
Any, excuse me, Chad. Mr. Howell.
Thank you, Chair Kinzer. Just real quick, this may be covered in that document, I don't know yet, but I had mentioned, about the emotional support part. Is that addressed somewhat in there?
We don't have a lot of funds allocated,
Right.
but we
I
are
understand.
talking with, Ms. Carter, our Counselor of Mental Health. She's already found some resources that we can use, and she's, looking to get those so we can deploy them out and start doing training on those. And those are similar to, being able to connect with students. On a side note, part of gathering information for this application is we had to reach out to principals and find out how many meaningful interactions that teachers have with students or students have with teachers, and it's pretty high across schools. We've had some teachers have been reaching out to students and interacting with them. The application doesn't define what a meaningful interaction is, so it could be I called them or I got them on Zoom, but however it said, those were high. So I think schools have been connecting with kids. We just have to look at how to refine that and do it better, because mental health's important. You know, the commissioner says in her priorities, right now she has them flipped. She says safe and healthy in academics, so which means focus more on mental health. So that could be a factor as we present the application.
So I know she's reached out to STARS and Centerstone, is that what you're referring to?
Right.
Those things? Okay.
Well, and even other resources too.
Okay, good. You know, as Mr. Sims alluded to earlier, you know, suicide is on the rise in Murray County, and you think of suicide, sometimes you think instantly of adults, and no, I'm personally seeing on the streets of Columbia, children that are contemplating suicide, and it's going up, and I don't mean like a little bit, a lot. So I just want to make sure that when we're looking at this, we're looking at a holistic approach to our students, not just academics, but their mental well-being as well.
Well, we do know that even though school's out, some of our contract we did have with STARS, and they came back and they did try to reach out with the children they had already contracted with and served them. So that was good, and we know that if kids aren't in school, sometimes we're not able to connect with them, and we need to do that, figure out how to do that if we're not in school, and continue to connect with them.
Anyone else? Okay, Thursday, 6 o'clock, Zoom or here, right? What? They'll send out the number, it'll be, yeah. All right, and the last item on the, I added to it, I know that when we had our work session, our last budget meeting, there was discussion about loss of positions or, that we might need to look at retirees, non-renewals, and that. And that's really all we said. We wanted to know how many retirees, how many non-renewals, so that if we had to decrease our staff, it would just be not by body, but by position. But we didn't say just freeze it all, because there are just some jobs that really need to be filled, in my opinion, especially elementary right now. So that went out to all the principals. I think that was somewhat of a shock to all of them, because they are in the process. It was a shock to us, because that wasn't what it was not, and I'm speaking for myself, it wasn't what I perceived to be the intention. So I'm just asking now, where are we in this?
Thank you, ma'am. So we had a meeting today, met at 1 o'clock. We talked the budget. We're prepared to bring a budget, balanced budget to you guys on Wednesday. And if the balanced budget looks good to you guys, then we're prepared to immediately release the hiring freeze and contact with principals about who they can begin to hire. Sheriff, do you want to talk more on that?
While we were in the meeting, Doug went ahead and sent you all the discussions that we had this afternoon in the meeting, so you all should have received an email stating the summary sheet that we kind of had at the last work session, and he went ahead and sent the executive meeting that we had today and what cuts we were able to make. And I think the discussion that just on the office side or the individual side, the goal was not to stop anybody from hiring permanently. It was just for the week, because principals in a lot of positions, there was already somebody who might be moving into that position that worked at the schools. So it was just like, let's not offer somebody a position that you all decide to cut, and we've already offered that position. And the list that I was putting together, I sent out just a question asking that, is there a way to get a snapshot, because it's a moving sheet. So what I sent you all last week, it could have been totally different this week, and you could have voted on a position that would have already been filled, and then you would have to either turn around and tell the person they can't be hired in that position, or that the district offered them a position that needs to be cut. So I really don't know, like, I just passed the question along saying, is there gonna be a stopping point, or where does the decision come from? And then I left it up to Mr. Lindsay and Mr. Marzak to figure the rest out, because I was like, my list has changed, because I started putting the list the day after the meeting. And Tanika from HR sent me all the information they had. Well, as she was sending me 5 or 10 minutes later, or within the day, I would get 3 or 4 emails saying, well, those positions I sent you, well, erase that, because now we've got this one open and this one's already replaced. And so I was like, there's no way to put a list together to give you all a proper picture of what we have open if there's not a stopping point for just a week, really. I think it's just a week and a half, so that was the intention behind what I had originally asked for, so.
Okay. I just wanted it to be understood that it wasn't something that the board took action on. I understand what you're saying, and we did ask you to let us know, but the way it was worded, it was as if this was from us.
Okay. Yeah, I never saw the email that went out to all the principals. All I asked was, is there gonna be a week worth of stopping point, and I forwarded it on to Mr. Lindsay, and then he took it from there.
Ms. Parker?
Thank you for that information. I certainly understand the need to have a stopping point, but, when I pull up the positions that are posted in, on our website, it specifically says for almost every position that I've pulled up, this position is to begin July 1st, 2020. This position is pending funding for the 2020-2021 school year. So I'm really confused why there was even a need to institute a hiring freeze, quote unquote, and for that hiring freeze to potentially last until Wednesday, when I'm not convinced that we're going to be able to approve a budget, considering the fact that it's Monday at 7:40 and I haven't looked at anything, and I'm pretty sure that none of my fellow board members have. I think it's very important that HR, that management do its job and start approving these positions. I understand that we've all been busy, but I'll say this. My children having a teacher on August 1st or August 14th or September 1st, whatever, is way more important than, quite frankly, having a budget or having a superintendent. It just is. So I'm really, I really feel like it was disrespectful to this board, the way that it was sent out, the way that it was couched as that was our decision. I know that didn't come from finance, but it made it look like we did something that we did not do, and there has never been an email to my knowledge that has corrected that, and that's offensive. Some people won't be here after June 30th, but others will, and it's important that the truth be spoken. I would also like to ask, on the budget that's going to be proposed on Wednesday, are there any new positions included in it? Okay. Can you also provide for us, for that meeting, and I guess I'm probably looking at Dr. Marzak for this, I would like to know BEP formula, particularly for elementary. We were talking about, I think Ms. Kinzer alluded to it, but we know how many teachers we've got to have based on the students and what our projections are. My question is, what do we get paid for by the state? And that includes administrative positions. So looking at central office, if there are positions that we have that we don't get funding for, to me, those are positions that we need to look at and determine whether or not those are positions that we need to have. That's the things that I'm going to be looking for in this budget going forward, because obviously the state has set forward what they're going to pay us for, and I think it's important that we know what the local side is paying for, and we have full transparency about those issues. So I hope we can, have that information as soon as possible in order to look at this budget for Wednesday.
I am looking at the email we got late this afternoon from Mr. O'Conin that has the cuts that they made today and, the potential cuts and,
It just came at 6 o'clock.
it came at, well, I'm gonna forward it to you right now.
He sent it to board at Murray K-12, the email, that was the. It's Tommy.
Hey, Tommy, we were bragging about we didn't have any problems, so now. Oh, my goodness. It says to the board clearly, so I don't know why. Huh? You got it?
The stuff's also posted on the website. I just did that during the meeting as well. So you should be able to see that. There's only one document out of that email that I did not post because I felt like till y'all made a decision, that information probably doesn't need to be on the website for positions.
Okay. Okay, hopefully you all will get this. I'll forward it to you myself, and
Yeah,
I
I'm
don't
not
know
sure
why
what
some
happened.
get it and some don't. I really don't.
Doug went to spam. That's on record now.
Well, you know,
Shirley, put that in the minutes. Doug's emails are going to spam.
well, his emails have to be approved, so, and Tommy
Yeah.
did, so,
Well, tell him he's not spam to me.
It's not in your spam.
no,
Okay.
we, that's right.
That's okay. So like I said, most of those he sent 4 documents out. 3 of those PDFs are already on the website.
All right,
for
now I'm
review
sending it as
well.
well. Okay. All right, is there any other, yes, Dr. Marzak?
Yes, so the email that went out, from Scott Lindsay to principals on Friday, May 22nd at 2:56 p.m. said, at Wednesday's school board meeting to discuss the budget, a question was raised regarding how many vacant positions we currently have. In order to have an accurate assessment of what our vacancies are, we have decided to have a temporary hiring freeze on all positions. You may continue to interview candidates, but cannot offer to hire the candidate. Hopefully this will not last long and you will be able to resume the hiring process soon. I'm trying to ascertain what's disrespectful about the email. If you could please clarify for me, or if somebody could clarify for me.
I didn't use the word disrespectful, but I think we were not, it was just, to me, a freeze is a pretty big thing, and it was, you know, principals were already emailing us, what's going on, and I just didn't have an answer for it. Ms. Parker?
Well, I'll be very straightforward about it.
Please.
Instead of reading to children each day on Facebook Live, perhaps we should be ascertaining what our kids need and determining what our needs are going forward.
Mm-hmm.
You know, I participated in the Zoom meeting last Thursday, I think. Yes, the one
Friday.
a week ago. We didn't have one on Friday.
That's right.
So, and I find it curious that Dr. Marzak's not participating on it. And then we get an email, and you basically said, I'm not gonna, you know, we got an email from you saying that Dr. Woodard was handling it, and that the employees that were gonna be here after June 30th were gonna be the ones that were handling it. And when we had the discussion about Dr. Marzak continuing to work here until June 30th, I believe, you know, we did not know that we were gonna have a pandemic, but I also think that we expected to have the expertise that you bring to the table, at the table. And the fact that we're looking at opening up school in the middle of a pandemic, you know, with all these issues that we just got a, 20-page document on,
Mm-hmm.
I don't know that you've looked at it, because you weren't participating in that meeting. It's just very concerning to me. And when you are getting questions from principals, when you're getting emails and you're getting phone calls, I don't think when they called me, they said they had heard it was from the board. So there was confusion there, and I think that was relayed to you, Dr. Marzak, and how you choose to handle it, that's your decision. We're not evaluating you anymore, so it's a non-issue, but I do think people need to understand the direction that we're getting in this really, really difficult time.
Interesting.
Is there anything else? Then I'll entertain a motion to adjourn. Mr. Moore, motion's made. Mr. Beaver and everybody seconded the motion. All those in favor say aye. Good evening.